Okay, so let's make a start. For those of you who are joining this session for the first time, just to introduce myself, my name is Ramanjeet Singh, and I'm going to be your lecturer for this particular unit, which is academic and research skills. This is a common unit between health and social care and business, and we sometimes do get learners across both the subjects which are doing, this particular course to join in together on this unit. And that's to obviously keep the interaction going. And also for some of them who have not attended the sessions live previously can actually look at, refreshing some parts of it that they have understood or gone through the recording. Now, this particular unit is an important unit at level 3 because of various reasons. And they could be primarily reasons like, we need to understand what is the importance of research. We need to understand what are skills. And also sometimes, we need to be able to clearly differentiate what are personal skills, professional skills. These are also called hard, and sometimes we categorize them as hard and soft skills as well. And then from a research perspective, this particular unit is important is because when we look at, research, we need to be able to look at understanding activities that we undertake primarily for the reasons of, sometimes finding out reasons or issues behind certain things or the way things happen, and is to establish facts. And sometimes the methodology or the way that you undertake research is sometimes quite important because of the fact that it allows you to do or carry out a systematic investigation, and that investigation leads to you finding out or establishing facts and help reach maybe newer ways through which you can address problems, issues that can be faced in the future. So this unit typically is a twin unit in the sense it is academic skills and research skills. And then we will relate it to why research, is important when we talk about, in health and social care. And why do we need to look at having a basic bit of understanding of research, in business? So if I look at research in health and social care, the importance of research in health and social care is required because sometimes you undergo trainings and you undergo, mandatory trainings with the employers at your workplace. It is important for you to understand and differentiate between how, various issues can be resolved or, addressed. In some cases, in the case of healthcare, we look at privacy, we look at dignity, respect, and you also need to look at, the issues related to cultural background. And if we are able to do some research in terms of finding out how, care is provided and what are the parameters on which care should not be differentiated, then in those cases, it helps us identify or, help us provide a better, let's say, care to the patient or to individuals who are receiving care within the health and social care sector. It also is related to the fact that sometimes, when you do research or when you find out why this is happening or go into depths of investigating the reasons behind some sort of a phenomena or why, this happens or why this occurs, then it allows you to also understand risk factors and outcomes of treatments, essentially, when they are applied to patients or patients are given medication. And in some cases, proper research can help in making interventions and also allow, costs and lives to be saved because of the fact that if something is not going right and research tells you that it is not going right and this should not be done, then there are ways through which you can look into dipping back into the, past findings, and that allow you to also inform and make better decisions in the future. Now, when we look at research, why is research important in business or any journal organization, any organization or business which is selling goods and services or offering any sort of goods and services to consumers, customers, even it could be the NHS, which offers, healthcare services, mental health care services. Here, we are looking at basically taking into account reasons of why and how, say, for example, certain things should be done. And that would mean in some cases that we are looking at, putting into place what is called identifying key issues, key threats, or areas of opportunities which could be utilized to help make better decisions, to help avoid these better decisions. I think the better decisions is because we need to look at tackling issues or problems that we face on a day-to-day basis, or in our working at a workplace or within a business or an organization. And sometimes, in order to understand customers, we also go into research, because what we want to do is understand. And I think one of the examples that I would give is, when you talk about customer experience, a lot of services which are provided at the end of it serve you some sort of a questionnaire or a feedback survey. Now, when you go and stay at a hotel, you go on a vacation, you stay in a hotel, you use a service, you maybe rent a car, you go to the NHS, get a surgery done, or if you are receiving treatment, towards the end of it, you receive what is called a questionnaire. And the reason why this feedback is collected via the questionnaire is to try and understand whether the requirements, or whether you were, the treatment provided, or, the facilities provided, or the services provided were actually meeting your requirement or not. And in what areas that these services and these requirements did not meet your expectation. And this is one of the clear reasons of why research is done, is because feedback is taken. And at the end of the day, all services organization, all businesses, all public sector, private sector organizations are looking at providing a good customer experience, or at least value for money, as sometimes we say. When you are looking at paying for a service, you expect, the service to deliver in terms of returns that you're expecting. And they are, measured at the end of the year in year-end surveys, or probably surveys that are done at the end of your vacation, or at the end of your stay, or at the end of your treatment, would help better inform people that how these services were perceived, how they were delivered, and whether they met the expectation of the individuals, customers, patients or not. So research is a very, very important area. It's very crucial for business, and it could be important in the case of businesses because it helps you understand market, it helps you identify trends or preferences which are shaping up and why consumer demand is changing. It also helps you do risk assessment. It helps in decision making, as I mentioned. It also looks at building services, keeping in mind what customers need, and thereby increasing customer satisfaction and loyalty at the end of it. And then in some cases, even this is used as a pretext to look at providing alternatives to competitive offerings. So when you have Me Too products available in the market, sometimes you would see research is done by the company to try and innovate and come out with innovative products or specs or features in those products which allow them to differentiate their products and services from competitors. Research could be done for n number of reasons, but what we want to be able to understand at level 3 in this unit is why is research done, how is it done, what are the various types of research, and how it can be helpful to a business organization or a service sector, public sector, or a private sector organization. Similarly, when we talk about research in healthcare, we are looking at various reasons of why research is important, and it has its own reasons of why this would be important is because, for example, if you see over the years, we have had lots of experimentation and lots of studies which have been conducted to understand issues which surround cancer, for example, heart diseases, for example, diabetes, for example. And if we go back into the 18th century or earlier, what we do see is scientists or, researchers actually coming up with penicillin, which was the first drug to be produced or recognized when clinical operations are done, and morphine, for example. So basically advancing medical knowledge requires some sort of research. There are new treatments which can be developed, therapies which can be developed, and they would require research. And in some cases, when we look at medical research is generally supported by what is called evidence-based research or practice. And this tends to be an example. If I give COVID-19, for example, you look at the vaccines produced by Pfizer, Moderna, Johnson, AstraZeneca, lots of different companies across the world. You see that they did an extensive amount of research on the protein, which was the SARS-19 virus. And on that, they tested, obviously, and then, the testing of that vaccination before it was available and used to, do mass vaccinations for humans, it was tried and tested over, different types of animals, rats, mice, mammals. When we found out that there were no side effects, the formulas were tweaked. And obviously, vaccinations were, if there were side effects or any sort of detrimental effects or threats to life, if they were discovered, the team went back to doing research again. And this basically informs what is called evidence-based research. That means you need to practice, put it into practice, see what are the results, analyze the data, and then go back and again analyze the data to see how until the perfected, formula is produced. You also look at, various other things. When I talk about customer satisfaction on a business and organization basis, you would primarily see better patient outcomes in the case of National Health Service. Obviously, research also helps us in saving costs in places wherein, excess spending or excess, treatments which are not yielding to results or providing results as per the research parameters sometimes are, stopped, and they help in saving costs. And also, to a certain extent, in health and social care, it is very important is because it allows continuous improvement as a process to work when we talk about, healthcare issues. So if we look at things that are evolving, COVID-19 as a pandemic, it took 2.5, 3 years for globally all countries, health departments, World Health Organization working together to bring it under control. And as you would see that this was a gradual process through which the pandemic was brought under control. Isolation, lockdowns, restrictions on the movement, obviously looking at detecting different variants of COVID-19 virus, and then creating vaccination or medicines, which basically allowed the, let's say the spread of this virus finally allowed, us to control or overcome this pandemic. So obviously there was continuous improvement being done, and obviously still to date, as you would see, COVID-19 viruses, vaccinations are being changed, or formulas are undergoing any sort of changes if a new variant is discovered, and that allows ongoing existing treatments and procedures to be improved, and in some cases even introduction of better technologies which makes the treatments much more accessible. If you look at the Pfizer Moderna vaccine, it needs to be stored at -40-degree temperatures. Now, this is not an easy task when we look at some countries wherein the vaccination had to be taken across to remote areas, and there were alternatives sourced, wherein some of the vaccination and the formulas did not require storage at -40 degrees. And that allowed continuous improvement in the vaccination process to happen, thereby bringing the pandemic under control. So, in general, if we look at research is very important as far as both business and healthcare is concerned. Now, when we look at studying this particular unit, we are looking at not focusing very broadly on these parameters, but we are going to be looking at focusing on parameters which are related to our course and subject area. So in the unit, we are going to narrow it down to understand what are your academic skills, and we will narrow it down in terms of when we talk about academic skills, we'll go down to skills which we think and know as critical thinking skills, reading and writing skills, research skills, study skills. And then on the research side, we are going to be looking into understanding how research is conducted, what are the various methodologies, what are the various types of research, and how research will generally helps us when you are looking at undertaking research projects or research studies during the course of your education. Now, this particular unit is graded pass, merit, and distinction for 15 credits in terms of the credits value. There are 6 learning outcomes in this unit, as you can see. 1, 2, 3, 4, 5, 6. Some learning outcomes have 1 or 2 assessment criteria. Some have merit and distinction opportunities. And this unit is best studied through some, through some tasks and templates that we will provide, which will be required to be filled, so that when you produce that output, that will be used as an evidence and will become an overall part of your assignment. The reason I say this is when I look at the grade descriptors on the learning outcomes that you see on your side, the grade descriptors, things like be able to, or, know how, or essentially understand. These are what are grade descriptors, which basically define, what is required to be done in terms of study of these learning outcomes. So when we talk about grade descriptors, these are basically statements created by awarding bodies, and they are expected to help you determine your skills and understanding and build your understanding on a particular subject area. And these grade descriptors typically tend to be of 3 or 4 different types. So when we talk about, what does this mean when we talk about, be able to, or when we say, so if I say, what does this mean, be able to, or understand, or know, in some cases, what you are going to be able to see is that be able to would mean that you are going to be required to physically, undertake that activity, or basically undertake that activity, and that implies that you are going to show your capability, and in terms of carrying out that particular task. So it's a necessary skill that you would not be able to do it descriptively. That means it is not a theoretical part or a theoretical part of the unit. It is a part wherein you are required to show or demonstrate your capability of doing something. And when we say, know how, or when we say basically understand, then in this case, what you're looking at is primarily, talking about theoretically, the topic, and talking about theoretically the topic would mean that in this case, it is more of you to understand and embrace and get some knowledge by studying that particular, topic. So when I say know how, or know how to do research, here we are talking about, understanding what are the various types of research, and, primary, secondary, tertiary research, what are the methods involved, and how do they help you in carrying out activities which are related to finding out information or undertaking investigation to resolve an issue, to go to the depths of finding out why these problems occur or why these issues happen. So in other words, if I say, when we talk about know how, we are basically going to be looking at your ability, your aptitude, your background, and also, your ability to be able to understand these theoretical concepts. So in order for us to cover this unit, wherever we see be able to, this bit as a descriptor, you will have a template that you would need to complete. And that would mean you would carry out that task or an exercise or an activity on your own self. And that evidence that you create by carrying out that task and activity will become an evidence for your task 1 of the assignment. This unit is mostly practical. That means you have to do activities, and those activities have to be done by taking examples or by practically demonstrating your knowledge and abilities to be able to cover this unit. So if you see in the 6 learning outcomes, the only theoretical outcome is learning outcome 2, wherein we will need to understand what the types of research methods and how research is carried out. And that is the only bit that is going to be like a descriptive part in your assignment, or a descriptive part of your report in the assignment. Rest of them, I'm going to be providing templates, and those templates will have to be completed by to the best of your ability to be able to submit, and that will become a part and parcel of your assignment. So 6 learning outcomes. We are looking at basically covering this unit in 7 sessions, and Mondays and Tuesdays at 11 a.m. these sessions would happen, and they would essentially be looking at covering, each session would cover one particular learning outcome from a point of view of, coverage on the unit. So today's session that we are going to do is primarily a bit of introduction that I've done, and I'm going to be looking at covering learning outcome 1. Now in learning outcome 1, and this discussion we will do with the help of a PowerPoint presentation. And along with that, I will also show you the templates that I will provide, which will allow you to complete some of the assessment criteria given in the learning outcome 1. So let me switch. And when we look at covering learning outcomes, these are the indicative contents that we are going to be covering in each of the learning outcomes. So learning outcome 1 focuses on, helping you to assess your own academic competence in order to, conduct research or, do academic writing. And when we look at what content is to be covered, we are going to be looking at academic competencies like reading, writing, speaking, and listening. We're going to be looking at doing a bit of self-assessment, which is using SWOT analysis, and an English test assessment that we will do, because it is about reading, writing, speaking, and listening. We'll also be looking at using a template called SMART targets. And then for the merit task, we are going to be using our SWOT that we have carried out and these SMART targets that we are setting to create what is called a personal development plan. And in that personal development plan, we'll be looking at, setting targets, putting some time scales, and undertaking certain activities which will help us essentially, achieve those skills or develop those skills. So let me just switch you over to the presentation, and then we'll discuss some parts of this with regards to, going forward on the unit. Any questions on this so far? Any questions? You're able to hear me okay? See the screen okay?
Yes. Yes, I'm
good stuff. So you can also ask if there are any questions that you want to through the chat route. You can stop me, and ask me questions if you feel that there are areas of doubt or you would want to clarify something. That would be more than, I'm more than happy to do that. Now, I've explained to you the unit aims. The unit aim is basically to help you develop academic and research skills and language skills, which will allow you to be proficient in academic writing and will help you develop and understand the research methods in a much more better way than, and maybe hopefully better your understanding in a way of what you currently have when we talk about research and research methods. Now, let's look at some key terminology, because the unit is made up of three key words: academic skills, and it is made up of, research skills as a word. So what I want to be able to do is look at what are academic skills. Now, academic skills, if I have to define them, they are basically a set of competencies that you need to have, whether you work, these competencies could be at your place of work, that would be helpful, or when you're studying, or, when you're, say, for example, doing a particular activity, and these skills would be useful for you to, let's say, understand a topic or maybe, carry out an activity. Now, what are these academic skills? So when we talk about academic skills, we are basically referring to skills which are related to critical thinking. That means I have the ability to be able to analyze ideas, look at, say, for example, sentences are, with basically objectivity. And I have the ability to be able to put reasons behind why this is the case, or, why essentially we are able to, primarily go about, essentially doing or, understanding certain things. So when we say, when we say, for example, the ability to be able to analyze something, what we are looking at is primarily an ability which basically means that when we talk about critical thinking, or when we talk about something which is required by us to be able to think and think rationally or go behind logically to reason why this is happening, they would be skills that would be related to what is called critical thinking. And when we talk about critical thinking, we'll be looking at things like observations that you can do, analysis that you can do by looking at certain situations, or when you can draw inferences or conclusions from a particular event or a particular happening. In some cases, you are able to communicate those inferences and analysis to other colleagues, people within the organization at your place of work. And in some cases, you're able to even look at problem solving. That means you're able to, identify where the faults are and then go about suggesting how do we go about solving this problem. And these would be skills which will be related to critical thinking. Now, when we talk about reading and writing skills, we are basically talking about skills that you have the ability to be able to read books, journals, research, or maybe take out meaningful data, primarily coming across from anything that you have read, like books or journals, and then put it to appropriate use with regards to, in this case, when you write assignments, for example. One of the reasons why you need academic writing skills is because you need to be able to read something, then write it in your own words, which is paraphrasing. Sometimes you need to build arguments when we look at analysis, critical, evaluation, or comparing and contrasting situations, then you need to be able to look at statements, build arguments, and then give, positive or negatives of that argument, and then towards the end make a conclusion. So that is where academic writing skills are important. When we look at research skills, they are basically these skills that you are able to effectively go about, finding out, let's say, why things happen or what makes these things happen, where are the issues, basically investigative skills. And these investigative skills could be coming into effect when you're looking at going into finding out or doing a fact finding by studying books, articles, journals, previous studies, previous activities which have been undertaken to understand reasons or influences of why what causes these problems, and they would be important from a point of view of research skills. When we talk about study skills, we are looking at abilities that you have in terms of time management, organization, being able to set goals and objectives, and then discipline, or basically using self-discipline, go about completing and achieving those goals. You have the ability to take notes, manage your workload, and also look at, obviously producing appropriate outputs, in this case, an assignment, and they would generally be classed as, study skills. Now, there are a lot of different types of academic skills. So academic skills, if I go into, would also include things like presentation skills, problem solving skills, good communication skills, and sometimes collaboration skills, which is working within teams to be able to accomplish bigger tasks or goals which are required to be done, sometimes at your place of work, or sometimes when you are given an opportunity within the class to do group discussions, you come up with arguments, you come up with data, you come up with a plan. And then if you are 2 or 3 of you in the group, then you decide which one will present what part and the others will present the other part, what role you would play in your overall discussion that you're presenting to other colleagues or, friends in the class, is basically looking at the ability to be able to collaborate and, work within teams. So these are in general broadly classed as academic skills that you need to have. So these are some of the things that we'll be dwelling into in this particular unit. And when I look at research skills, if I go into a bit more detail, research skills would fall as a subset into academic skills. But you are also, if I go into detailing of what are research skills, we are looking at the ability that you have to be able to locate, organize, evaluate information on a particular subject. You are able to do investigation, undertake studies, come up with logical reasonings in terms of why this event has happened by studying existing data or past data, and then suggesting possible solutions to those problems. They would be looking at broadly, if I say research skills. They would also include things like you being able to understand what is data, how data can be converted into information, and how information can be used to make decisions. And that would be coming across through information literacy, data collection, analysis of data. And at some stage, critical thinking or analysis of data would mean you're crunching the data into meaningful numbers. Now, if you work within an organization, just as an example, and you look at a particular, graph, if I say COVID-19, let's say COVID-19 vaccination, say, for example, rates. I'm just going to try and pull out a image or a graph, which basically would help, bring this point across. So if I look at this particular graph, just as an example. Now, if I have to make sense of this particular graph, if I just bring a better and a more, let's say better version of this. Give me 1 second. Let me try and see if I can bring a better version. So if I bring this as a graph, for example, this is a report from CDC in the US, probably talks about, how the vaccination is happening across maybe, past data, but how the vaccination is happening across maybe states. Now, if I have access to this report and I know what part of the report this graph is actually alluding to, then it makes sense for me because I know either I'm the person who's compiled the report or I'm the person who's actually read the inference to the report. Now, if I was to put this across as a chart on the slide and say what it is, some of you would come up with some ideas and say, okay, this is a data, from CDC because there's a logo here. There is something on the y-axis that says doses, and on the x-axis it says date of the CDC report. So it shows some sort of, tracking which is happening in terms of doses, and maybe doses for vaccines or medicines and things like that. Now, when I say data crunching and when I say, critical thinking, what we would be looking at doing is when we get data and when we collect this data in terms of number of vaccinations happening across various states or districts in the US, just as an example, at some stage, what we would want to do is for the management, for general public, what we will do is we'll publish this graph, but under this graph, what we are going to do is write something which will say, or basically depict, what is actually happening in terms of, information. And this, if I put in case in point, just because we've discussed this. So if I take you to this slide and I slightly minimize this, 1 second, and I put this graph here. Now, with this description, I can make sense that this is allowing me to understand that what data has been compiled on the graph. That means it shows COVID-19 cases and hospitalizations are declining across the United States. However, when we see the red line going across, it shows deaths are still rising because of community transmission. And it also shows that there are 211 million people in the United States which have still received, which are still to receive the first dose of the COVID-19 vaccination when this drive was started by CDC. So when we look at research skills and we look at analyzing data, what we are going to do is this data would be coming in from various states. And at some point in time, somebody in the back office or the head office of CDC, which is the Center for Disease Control and Prevention, would be crunching data and compiling it into some sort of a report. And that requires what is called data analysis. And then the creation of the graph to depict this information basically shows critical thinking. That means we are tracking the number of doses. That means number of vaccinations which are happening across the number of across the population, and how is it leading to decrease in the number of deaths or decreasing the number of decreasing the transmission which is happening in this case. And that would be required from an aspect of understanding research. So when we continue with research skills, what you're looking at is understanding how research can be applied, how research reports can be created. Sometimes when you have to collect data from different sources, you have to cite these sources to make it more factual and authentic, and to ensure that, the data being put forward is something realistic. People can, trust that data. So in those cases, you would normally look at citation and referencing. And most part of it, research is done to help solve problems. It is basically to look at answering a question, a basic problem which has occurred, and that is why you undertake investigative, studies, or go into undertaking series of activities such as investigation to study why this has happened or how this has happened and how this can be prevented in the future. So academic and research skills are very important from an aspect of you looking at, building these skills at level 3. And this is something that you're going to use more often as you go into higher, classes or courses when you take at level 4 or level 5. And this would form the foundation of you understanding that why I need to have academic skills and why I need to develop my research skills. Is that okay? Any questions on this so far? Now, with this basic understanding, what we are going to now do is look at going into some of the assessment criteria of this unit. Now, the first assessment criteria of this unit talks about, finding out your academic strengths and weaknesses, including English language skills. That's the first assessment criteria. Now, in order to accomplish this, what we are going to do is, if I shift you over to our website, and this link that is given on the slide here, we are going to undertake a bit of a test, and that is a free test that you're going to do to determine your level and proficiency of English language. So here, if you go onto this link, which is given on the site, and you go to the British Council IELTS website, what you would need to do is basically register here first. And this is free registration. You can put your actual details in to be able to register. And when you do the registration here, what you are going to do at some stage would be your name, your surname, your place of residence, and this will help you create a bit of an account with the British IELTS website. Now, once this account is created, it will send you a link. So if I look at putting my details in, and put details in, for example, which is something that you can access because it is going to send you an email. So what I'm going to do is put my suggested username and my password so that I'm able to log in. And I'm going to try and put a full name just in case if it is there. And I don't want to receive monthly newsletters. I'm over the age of 18, and I click I'm not a robot, and I would say create an account. Now, if your username is unique, it'll allow you to create an account and registration is successful. Now, what we need to be able to do is take this test. So this is a free test that you can take to test your English language proficiency. It is going to be an half-an-hour test. So if I just go back for a second, as you can see, this test is going to be an objective or a multiple choice question test. It should take not more than 30 minutes for you to complete or half an hour to complete. And the test would then, towards the end, when you start the test and when you complete, towards the end, it will give you a score. Now, this score that you get would be required to be taken as what is called, a screenshot. Because what we are looking at, why we are looking at taking this test is because we are looking at primarily understanding what is our English language ability in terms of reading, writing, or, in terms of, say, for example, reading, writing, speaking, and listening. Now, I'm not going to do the test, but I will explain and obviously send this to you as a link on the, WhatsApp as well as on this chat right now. And that would mean you should be able to register and use this to take the test. Now, when you've taken the test, towards the end of it, what will happen is you will be allowed, or you'll be given your results, and this is how your results would look like, just as an example. So it will say, and there is a detailing of this results, which you can actually also see. So in this case, I have a sample screenshot of a test taken by a learner, and that shows that the learner has B1 level of English proficiency, and the score is 355. Now, there are ways in which you can actually get hold of a certificate. If you want to do so, the certificate is going to be, it's going to cost you, and that certificate primarily will come across, through an app which the British Council has. And if I show you that app as well, for those of you who want to keep a record, it's something that you can do. There is this app that you can also download if you want to do it on your phone. This app is called the English Score app, as you can see on the top. This English Score app is free. It's a free application from British Council, but and it's an app which will allow you to sit a test. The test will require you to have your camera and your audio switched on. The moment you move your face away from the app or you look away from the phone, then the test actually stops. Now, again, it's a multiple choice question test, but at the end of it, there is an option in the application to apply and get a certificate. This certificate is like a IELTS certificate. Some institutions accept it because it provides your English proficiency. This is valid for a period of 2 years. It can be verified on British IELTS server. So it is going to capture screenshots of you while you're doing the test at different points in time. It's a very authentic test. If some of you who want to take this test could look at doing the test, and towards the end of it, just take a screenshot of this when it comes, And if you want to apply and get a certificate, I think there's a cost of £19.99. So just shy of 1 penny, £20 to be able to get a PDF certificate from British Council. Now, this part would accomplish, I would say, your task 1.1, because in task 1.1, it is going to ask you to assess your English language skills. And what we've done is, rather than draw up a table or essentially look at assessing our skills through some sort of objective multiple choice question tests, what we've done is we've taken an authentic route by going on to the British Council's IELTS website, and that has allowed me to test my English proficiency by undertaking this test. So a screenshot of the end result would be acceptable. You don't need to necessarily get a certificate, but a screenshot of the end result would also be acceptable. And this link I have placed on the website, on the presentation, and I've also texted you onto the chat in the Zoom meeting chat. Now, in accordance to checking my strengths and weaknesses, there are loads of other areas, because when you look at English as a language, because it is talking about English language skills, within English language, when we look at reading and writing, there are further skills that can be tested. So when I look at writing, I can test my grammar, my vocabulary, my punctuation. But when I look at reading, I can check my comprehension skills. And when I look at, speaking or listening, I'm also able to test my skills of active listening, understanding, apprehension, or looking at arguments, understanding the arguments which are being raised, and then appropriately answer. It also helps me check my fluency, my accuracy in terms of how do I speak and whether I'm factually and accurately speaking or presenting my thoughts. And then to a certain extent, if you speak confidently, although it is not a parameter, but yes, it also helps build confidence or exude confidence. If you are able to speak a language in a perfect manner, that means you're able to influence, you're able to interact, you're able to persuade, and you're able to build arguments and then objectively, deal with situations. And that helps build confidence when you have excellent or good language skills. Now, in addition to this, what I would suggest that we need to do is basically do a SWOT analysis. And the reason I say that we need to do a SWOT analysis is because I need to be able to understand what are my skills, and I want to differentiate my skills both into soft skills and into hard skills. So for this, what I'm going to do is, in addition to understanding assessment criteria 1.1, wherein we need to check our English proficiency, we also need to be able to carry out a SWOT analysis. Now, in order for you to carry out a SWOT analysis, SWOT, if most of you know, stands for strength, weaknesses, opportunities, and threats. So what we need to be able to do is identify what are your strengths, what are your weaknesses, what do you think are the areas of opportunity after completing this course or while studying this course. You see opportunities that will help you do better in life, and then look at some of the areas of threat that you think are areas that you need to improve on, or they could become areas which could pose challenges to you in the future if that is an area that you feel you have no knowledge or skills in, and they would be treated as threats. Now, in order to do your SWOT, you should be able to also classify and understand what are your hard skills and what are your soft skills. So when I say hard skills are skills. Anybody, do you know what are hard skills? Anybody who knows what is hard skills? So when we talk about hard skills, these are skills which primarily, there is a differentiation in terms of what are hard skills and what are soft skills. Hard skills are skills that we can learn. And, we can learn predominantly through what are called, courses. Or, for example, skills that you can, in fact, learn by, carrying out or undertaking any sort of study, training, or, through work experience. So if you have, say, for example, acquired a skill which is now translating into a specific ability, then in those cases, some of these skills, because they've been acquired primarily through the route of experience by undertaking a course or by attending a training, and these are things that will remain with you for life, they would be termed as hard skills. So these skills in general can be taught or learned. So if I say hard skills, and if I have to differentiate, they can be learned or taught. That is what we mean by, hard skills. And when I say what are soft skills? So in soft skills, when I say we are talking about skills which are what are called personal attributes, which are basically personal attributes of yourself. That means of a particular individual. They will enable you to interact or maybe discuss or maybe deal with people in a certain way. And these skills are basically termed as what are called personal attributes because they are dependent or are individual, different from individual to individual. So they will help you in social interactions. They will help you in situations wherein you would face problems, or they would be situations wherein you are able to, put some of your intelligence, communication, and interpersonal abilities or skills to use. And they would be normally termed as what are called soft skills. So it is important for us to understand that these are skills which are, skills that you can develop, but some of them you are, also having, and you are basically using or improving them over a point in time. And because they are person dependent, they are called soft skills. So when you identify your strengths and weaknesses, what you're going to be looking at primarily would be your professional skills, which are hard skills. And that is where you would carry out your essentially, your SWOT analysis. Now, this template, if I have to, I will provide this template to you. And what you will do is, this is, say, for example, if I, use this particular template, what I will do is empty this up. And then I would basically look at doing my SWOT analysis, which will be related to task 1.1. So I'll provide this as a template to you just after the session, so that this will help you, do your SWOT analysis. Now, again, remaining within the context of what we are expected to do in assessment criteria 1.1, we are looking at English language skills. So most of your focus could be on strength areas, weakness areas, could be on the areas related to your language skills. So you could identify your strengths like this. You could identify your weaknesses like this. And then that would help basically cover task 1.1 or assessment criteria 1.1. So looking at your English language test, which is to be done on the British Council website, take a screenshot of it, and then do your SWOT analysis using the template that I've provided, and then a bit of a write-up of 20 words to explain how you've gone about undertaking your SWOT and then English test. That would help accomplish assessment criteria 1.1. Is that okay?
Yes, that's okay.
Okay, good stuff. So second assessment criteria in today's learning outcome is, it says set targets for improvement using self-assessment. Now here, again, what we need to be able to do is, when we have identified our weaknesses, the threats that I face, then in those cases, what we need to be able to use is a template which I'm going to provide called the SMART target template. And basically using that template, what we should be able to do is set some goals for us to improve those. When I say goals, set the goals, but within the goals, what you're going to do is undertake activities to improve your weaknesses and mitigate your threats that you have uncovered while doing your SWOT analysis. So here, when it says set targets, we are going to focus on something called SMART targets. So when we look at SMART targets, this is an acronym, for specific, measurable, attainable, realistic, and time-bound based targets that you set. Now, just as a vague example, very vague or a literal example, if I say that I want to achieve, let's say from a health and social care point of view, you have a patient who comes in and he weighs in at about, or he or she weighs in at about 100 kgs. and she sets a target that I want to lose weight. I want to lose 10 kgs in, 30 days, or I want to lose 10 kgs in 10 kg weight in say about 2 weeks time. Now, what we are looking at is somebody setting a very aggressive target that if you are to lose 20 kgs of weight or 10 kgs of weight in 20 days might seem very impossible. But there could be a realistic planning which could go into if these number of activities are undertaken, then that would maybe help the individual, yes, lose the weight, lose that 10 kg weight. But it is going to be extremely difficult. And the person, if they are looking at doing it seriously, would need to be very determined to be able to do and carry out all the activities and follow a very strict regime to be able to reduce that 10 kg weight. So sometimes when we look at setting targets, by taking an example like this, that somebody wants to lose 10 kg weight or 20 kg weight and they weigh 100 kg and they need to look at doing this for some reason, then what we would generally do in those cases is put those targets under a category called SMART targets. That means, what is the target? The specific target is losing 10 kg weight. So it is very clear. The goal is lose 10 kg weight. Is it measurable? Yes, it is measurable. You can undertake some activities, do exercises that have been prescribed or as per your routine. And at the end of the day, you measure yourself on the weighing machine and you would see any differences or any, decrease in weight that is happening as you undertake these activities. So the result is measurable, and that is measurable daily. Now, is it attainable? There is a lot of question marks, but yes, if there are defined activities that you are undertaking, like you're eating balanced diet, you're basically exercising, you're walking, you're burning enough calories on a daily basis to be able to reach that target, then that goal could be attainable. But what will happen is when you set that target of losing 10 kg weight, you'll have to break that goal down into what is that target down into what is called attainable goals. And that could be 5-6 different goals that you undertake. That I'm going to run 10 kilometers a day. I'm going to exercise in the gym for an hour and a half, do cardiovascular exercises, and look at exercises which are going to help me reduce weight from wherever the flab is, on the stomach or on your bum or in your arms. And you're going to exercise that. And these are the goals that you are keeping, which are going to be attainable under the target that you have taken, which is losing 10 kg weight. Now, is it realistic or relevant? No, some of the activities you might say that I might, starve myself, or I might only have 2 meals a day. I might reduce significant amount of, intake in my meals. Now, is it relevant? Yes, it is relevant, but are the goals related to eating meals? Now, you might want to eat meals, but that meals would be more protein diet or a balanced diet, which is still giving you minimum energy for your body to work and function. You might not be taking 2,000 calories, but you might be eating about 1,000 calories because you're wanting to burn them to be able to lose fat. So in those cases, your goals will have to be realistic or relevant to what you're trying to do. If I may say, okay, I'll watch 3 movies a day to pass time and to keep myself preoccupied rather than think about food. Now, is that activity relevant to losing weight? Will it help you at the end of the 10 days or 20 days to lose weight? Probably not. So in this case, when you put activities or goals, activities that you're trying to achieve, those goals, they have to be realistic and relevant, either realistic or relevant. Sometimes it's interchangeably used, and they would then help you achieve that target. Now, the last part is time-based. Why is it time-bound or time-based? Is because you have a certain deadline. For example, sometimes people look at losing weight because they want to get married and obviously they want to fit into a particular dress. I want to be able to wear my wedding dress or things like that. So in those cases, you have a set time in which you have to lose weight. Otherwise, it will not be it'll not be possible, or it will not be of any help. So sometimes when you undertake activities, you have to put deadlines to it for completion. It can't be open-ended because these are things that you're undertaking for a specific reason. And that is where SMART targets, are followed when we set improvement targets within organizations or within businesses. And we follow this as a template. This is a template which can be applied to any particular business, organization, or any type of, goals and objectives that are being set by the management within an organization. Now, for this, in order to do this particular side of the task, what we need to be able to do is basically use this template, which I will provide. And this template is to be completed in order to look at, meeting the assessment criteria 1.2, which is set targets for improvement. Now, where will the targets come from? The targets will come from your SWOT analysis, which is what you've carried out in your previous task. So I've given an example here of understanding and developing Harvard referencing skills. So here, my target is to learn how to reference, how to use the Harvard referencing system. And that is what I would need to do by using an example. And that is what I've explained, how SMART targets can be used to develop Harvard referencing skills. If I'm not, aware of what is referencing and what are the various types of referencing system. In particular, I'm trying to learn about Harvard referencing. So I put some specific goal, which is I want to be able to Harvard reference my, use this technique to reference work when I'm writing my assignments. What are the measurable parameters? I need to be able to use direct quotes, in-text referencing, and paraphrasing. What are the tasks that I want to set? I will watch a video of Harvard referencing. I'll read a presentation about Harvard referencing. I'll use a referencing site or a function within Microsoft Word and develop my abilities to be able to reference when I am academically writing my assignments. Is it realistic? Yes, a referencing generator can allow me to use and create Harvard references. Practicing by doing it for one author, more than one author, up to 3 authors or a team, and in different situations would help me, master this particular technique over a point in time. And what are the time frame I'm setting myself as a goal? I'm giving myself 3 to 4 weeks to be able to complete this as a task and achieve and develop this particular skill. So using this particular template, what I've done is when I provide this document to you, you will use page 2 or page 3 if you want to look at more than 1 or 2. If you in your SWOT analysis uncovered 2, 3, 4 weaknesses, then depending on which ones are urgent and important, you could create and fill these 2 templates, and that would help you address the assessment criteria 1.2. Is that okay? Any questions on this? So for healthcare students, what I would suggest is you take something as a SMART target, like I've given an example of losing weight, or something in that direction, which is primarily related to your field. For students who are doing business, could take a SMART target in terms of like referencing skills, even your own academic skills, your English language skills, spoken skills, for example. Or you could look at something of a target which if you work at a particular organization, then sometimes you see organizations undertake what are called corrective action plans, or CAP. Now, there could be certain areas which businesses are having problems in, and sometimes managers ask employees to basically undertake a particular improvement target, which is normally going to help in creating a bit of efficiency and productivity for a process which is being used again and again in the organization. So you could look at something on your personal side from your SWOT plan, SWOT analysis, or you could even look at something which is related to your organization. But as long as it is meeting the criteria, which clearly defines the use and the usage of SMART targets, this would be looking at accomplishing this particular assessment criteria, which is 1.2. So I've given an example template here, which is what I will provide in Word document. And then in some cases, for those of you who are studying the healthcare course, you want to gain knowledge and information about the NHS, you are looking at reading, you're basically looking at compiling information. That could be one of the targets. And how would you go about doing it? By reading, various articles, going to the NHS website, maybe picking up a book on the National Health Service, and they would help you complete those part of the targets. So those are what are slides that I put on as additional slides after this, and best to be done as a Word document. Now, one last assessment criteria in today's learning outcome is we are looking at developing a plan to show how these targets will be achieved. So the SMART targets that we have set, what we are going to do is develop those SMART targets into what is called, so for example, this was a SMART target which was set. Using that SMART target, what we are going to do is develop that target into what is called a personal development plan, or a plan which will be useful for me to develop my skills. And that plan is going to be a combination of targets, time scales, and activities that I'm going to undertake to develop that skill or accomplish that task. So this is a template for the PDP, which I'm going to provide. This template for the PDP is what is called a personal development plan. And basically here you're going to list down the activities that you're going to take, why these activities are important. So you'll briefly describe them. How would you undertake these activities, or what are the sub-activities that you will undertake in order to improve or develop that skill, and what is the time frame in which you're going to develop that skill or do that or complete that activity is going to be mentioned here. Now, there is a full-fledged PDP template that I have, which I will provide. This is on Moodle as well, and they're labeled as 1.1, 1.2, and 1M1. The tasks are labeled and the templates are labeled. So for those of you who haven't ever constructed a personal development plan, this template is going to be a useful one for you to read and understand why this is required and why this is normally done in the health and social care sector in the National Health Service. You have an appraisal plan for the year, and your manager or your supervisor also asks you to develop what is called a personal development plan, which towards the end of the year, when it is appraised, helps to identify what are the areas of weakness that you need to overcome, or what are the areas which are required to be further developed through training and development, which your manager would then propose to the HR department or to a relevant department to say that I would want him or her to go on these training exercises throughout the year to develop knowledge, to develop skills, and to be able to work more effectively, or to be able to work more productively to discharge his or her duties. Now, it has a bit of commentary in terms of what is a personal development plan, what are the various terminologies in the personal development of the plan, and then a template which is given here, which basically will list out the activities that you decide to undertake in order to develop those skills. So this template is something which I've filled in, as you can see, as an example. But what you could do is basically copy this particular part of the template and then insert into a new document. In your case, insert into a new document and then blank it out. If I show you how, so if I just go to a new document, and then what you do is change the orientation to landscape, and then here paste it, and then blank this template out. What you would want to do and how you want to go about doing it, you just blank it out and then start from scratch and fill this up for yourself. And this would help you achieve, the merit criteria. Okay. And then towards the end, what you need to be able to do is put a review date down that I'm going to be looking at reviewing, my personal development plan, because what tends to happen is that in most cases, when you create a plan like this, at the end of the plan, at the end of the year, this is reviewed by yourself and your manager. And the reason of reviewing is they want to see what progress you have made in carrying out these activities. And if there are further activities or targets which need to be sent or basically developed in order for you to be able to, develop those skills. And that is what is, put into what is called the personal development plan. Now, this is a working document. This is a document that you make, you update, you again review it and again update it. And this is a document which you keep, for yourself while you work within an organization or, as you develop your career. And at some stage, most employers would want to see a documented personal development plan to say how you're improving, what targets you set, how you improve and go about undertaking new activities which help you develop new skills. And especially so in the case of, health and social care sector, As you know, most staff training undergoes training, a lot of training across the year, whether it's care workers, health and social care workers, nurses, any sort of practitioners like occupational therapists or, clinical nurses. They all undergo training throughout the year. And the reason of why they undergo training is to keep those skills up to date and current. And some of these skills are developed further when training is proposed by your employer. To undertake these, trainings means you're looking at sharpening your skills and you're looking at developing new skills. So this plan keeps elaborating year on year, and over a point in time shows how you are developing and, improving your abilities, working within a particular sector. Is that okay? Any questions on today's session? So that brings us to the end of, the session today. Wherein we have covered, most of the assessment criteria, 1.1, 1.2, 1.3, and then 1M1. So any questions on today's discussion? Okay, good stuff. So if there are any questions that you think of, we can also discuss when we do a recap tomorrow, when we discuss Learning Outcome 2. Up until then, I'm going to drop you some of these templates on the WhatsApp as well, so that all of you have it. And that should be, or they are also up available on Moodle. If I put it this way very quickly and show Moodle before I close, they would be easier for you to get from there, simply because they are easily accessible. And what I would suggest is when you download them, what you could do is primarily also save them. When you fill them up, you can save them on your side, so that as we go along in this unit, by the time you complete this unit with me, what will also happen is you'll be able to complete your assignment as well going forward. And that should be useful for you from a purpose of, looking at, completing this unit also. So if I go into academic and research skills for healthcare, I'll show for business as well. As you can see, it shows 1M1, 1.2, and 1.1. So SWOT template and the SMART objective template and the 1M1, which is the PDP personal development plan template. And similarly, if I go into business, for those of you who are doing the business course with us, you'd be able to see the same in the academic research skills unit. And they would be neatly labeled as templates, essentially, which are 1.1 for SWOT, 1.2, which is primarily for, SMART targets, and 1M1, which is predominantly for, the, personal development plan. So as you can see, the templates for SWOT analysis given here. And in this case, it'll also have the template primarily available for writing your PDP and your SMART targets. We'll just quickly make sure that they are there and put them in. There you go. So I'll catch up with you tomorrow. Take care, and thanks for joining this session. A recording of this session should be available to you shortly, and I'll post that link across on the WhatsApp group. And if we think of any things that we need, then we can catch up tomorrow in the second learning outcome discussion, same time at 11 a.m. Thank you so much for attending. Bye for now.